Moving on to the PARP inhibitors, I think these are sort of the newer drugs. Patients might have heard about this drug in the ovarian cancer setting or even in the breast cancer setting. But we have seen especially in prostate cancer, there are certain mutations in the DNA that if you have those mutations, whether that is in the tumor itself or you have genetically inherited, these medications can be used. And we won't go into too many details about this particular medication. Although I would love to tell you that these medications are also approved by the FDA in the first line setting if you have these mutations. We as physicians always check our patients if they have high risk prostate cancer, if they have castration sensitive prostate cancer or castration resistant prostate cancer. We always check for these mutations. So, this is something that can be a potential option, although right now it is available in the castration resistant setting mainly. We are also trying to see if we can bring it in the earlier stages. But I would love to hear from you guys, if there is anything else that you want to mention, especially these drugs now in combination have opened up a lot of new doors for patients who have BRCA1, BRCA2, these mutations, especially. But would love to hear, Dr. Tawagi, your input, and Dr. Kurian, your input on these drugs.
Yeah, absolutely. So in the stage 4 prostate cancer setting, we offer genetic testing to all our patients, and it's usually just a simple blood test. And up to 1 in 5 men may have been born with something or have a family history that they have one of these DNA repair mutations that predicts that they will actually respond better to these pills called PARP inhibitors. And then sometimes patients also have mutations on their tumor, their prostate cancer tumor. So it's not necessarily something they were born with or something in their family, but there are also these same mutations where they could also predict a response to these pills. And so right now, the only setting that they're approved, like you mentioned, is in the hormone resistant setting. There are clinical trials looking at giving it earlier. And so the pills are either given alone with the hormone shots or in combination with one of the other hormone pills that we talked about and the hormone shots. And in terms of which pills we give, really depends on what mutation they have. And even though they're approved for, over 20 mutations, the responses are not the same for all mutations. So we have to be careful about which ones we recommend. And in terms of side effects of these pills, a lot of GI symptoms, so nausea, a lot of fatigue, and then a lot of lowering of the blood counts. And sometimes patients maybe even need blood transfusions.
Yeah, and I think that's one of the critical side effects that these medications have. Although, especially it can transform into leukemias in some patients as well. So that is something that, as providers, we also keep a close eye when administering these medications.
And I'll add that Dr. Tawagi had brought up a great point in terms of genetic testing and stage 4 prostate cancer patients. I think is absolutely crucial to understand, some of these potential treatment options that, may be available to, patients if they meet criteria. Upfront, and, the BRCA1 and 2, or maybe some of those patients that may benefit potentially more. But again, this is still being explored more, and I think there's more data that needs to be collected about this as well. But I think it's good to have the options of knowing, if you have one of these mutations and knowing if that's a treatment option up front versus eventually, maybe down the line, it could be a treatment option as well. So I think that, getting that, hereditary testing and tumor genetic testing, I think is very important to understanding your options moving forward.
Yeah. And I'm not going to go into the details of the drugs. I know it can be overwhelming, but I'm just putting it out there. And we can make sure that patients can read these.